the Charge Syndrome Foundation Speaker Series. Managing Charge, Hidden Medical Issues Through the Lifespan, presented by Dr. Kim Blake. What are the problems that affect life expectancy in infants with Charge syndrome?
So I've been asked to speak about life expectancy. We know that life expectancy is a difficult subject to approach. I have a lot of people ask me about it, usually in private, maybe by an email, but what can I expect? They're often expecting the worst. It's things have changed. I think to be on a very, very positive note, which I think we are here, is that in the last 20 years, so I've been researching Charge for over 35 years now, so in the last 20 years we've seen dramatic changes for the better in life expectancy. Life expectancy for a little person with Charge syndrome is good, and it's good to the end as well. It's good. We are seeing people that are in their 40s, 50s, they're doing well. And I think that's been very reassuring. We've got wonderful adults. They don't want to be called young adults anymore. They are truly adults out there all together, getting together, looking extremely young, by the way. And they are alive, well, and doing extremely well. Now, there's a few caveats to that. Certainly, depending where you're born with Charge syndrome will make a difference. If you are born somewhere way up I'm in Canada, way up in the north of Canada, you have to be airlifted in, you are stuck without a good central hospital near you, then things aren't going to be, it's risky, it's more risky. And also you're going to have to traveling back and forth to your tertiary center. So life expectancy a lot of parents do move to be near better facilities, often schools and medical facilities. But given that, it's not a no-no, and there's going to be many parents out there who do not live near a tertiary center. Why I say tertiary centres is, I'm going to come to that later, is that we need to protect our children in as many ways as we can from mortality and morbidity. So the first couple of years of life, that first neonatal period, you take that first, say, 30 days, that's where you're going to see a lot of the deaths, and they're usually because of severe congenital heart defects, tracheoesophageal fistula, bilateral choanal atresia. You put all that lot together, and usually bad reflux as well. You've got a sort of a basic storm going on there. And really it's like anybody being born with very severe congenital heart disease. Most of the heart disease now can be fixed, but there are some that really can't. They're getting smaller and smaller, but there's still some there, as there are some cancers that can't be cured, even after lots of treatment. So that 30 days, 60 days, then you've got the first couple of years, and really everything goes down after that as far as it's still risky up until that airway starts to open up a bit more. It becomes, there's less reflux, or the kiddies are able to cope with the reflux better, or they're able to cope with aspiration better, they're able to motor power and sit up better. So all of the things we see, the physio, the education, the medical practice, the things we know about Charge, like the Charge gut, we know a lot more things now where we know we've got to take care of those systems. And as I've said in one of my other little clips, the checklist is very important for that. So all these things being put together, life expectancy has vastly improved.
Which features put children with Charge at highest risk?
There are things like arrhythmias of the heart, which come out of nowhere, or there may be things like a huge aspiration, which just happens to happen. We know that the population of Charge individuals are very much at risk for lots of things, and sometimes you can do everything you can do, and it's just a challenge. The challenges are usually with the kiddies that have got severe congenital heart, tracheoesophageal fistula. They're often trach, but they don't have to. Sometimes the trach saves them, but also you've got the ones that have got bad reflux guts and they've had a Nissen's fundo. You tie that together and they are going to be at higher risk. But there's a spectrum to everything. How can we protect the kids and make it a better life for them in our medical field? I think, again, being aware, checklists, going through things, not missing things. I have many a parent that contacts me and says, the doctor's missed and that could be a vascular ring, and that was causing all the problems with reflux, all the problems with pressure on the esophagus. It's rare, but looking for those things and checking that they're not missed. The parent stories I hear teach me, then I try and educate others, I try and do the research.
What should we know about anesthesia and postoperative events in charge?
One piece of research I've done I'm very proud of is the piece about anesthesia. So life expectancy can be improved if we don't have the kids under so many anesthetics. And if they go under anesthesia, are they in a good tertiary place? So if you said to me, my little kiddie just needs his testes popped down, I can pop to the local hospital to do that because that's what everybody else does. No, they've got charge syndrome. Their little testes, yes, need to come down, but they need to be in a tertiary center. So if something goes wrong, that anaesthetist is going to be the right one to put a tube down, which is tricky, or trach. Now, or very much mask to start with. And a good anaesthetist knows that you mask first, you don't fiddle around too much with an upper airway of a child with charge that collapses down quickly. And then if that's masking, you probably need to trach. And even traching is hard, trying to get the trach in the right place of a charged child where it's wobbly in there. So you need an anaesthetist that knows about charge. What do you do if you've got one that doesn't? You ask for the best person in the hospital, one that's aware, or you educate them. You say, I have a paper from Dr. Blake that's about anesthesia and charge syndrome and all the risks and things that can happen and post-operative airway events, and I would like an ICU bed available for when my child wakes up, particularly if it's a more long, complex operation, but it still can be with a small operation. And that can be, those post-operative airway events can be arrhythmias, apneas, aspiration and pneumonias, or near death and death. So things can happen there, and that should be controlled for. That's a controlled environment, and you should have control over that. So I think, again, education is important for the anesthesiologist to be prepared for the kids coming in with charge syndrome. They're not your regular kiddie, and they need to be respected for that, and the parents need to be respected because they've got the knowledge and they're taking it in. And if you feel you're not being listened to, then don't do it. Don't sign the consent and walk out. I know that's easier said than done, and I feel the parents who are here with their charge kiddies, young child individuals, they really can do it because they've been doing it. And I think to advocate, so the advocacy has improved over the years, the teaching has improved, the medical treatment has improved. I think us doctors have still got a long way to go to improve, but I think we can still be educated. And if they don't like being educated, then find a doctor that likes to be educated.
What advice would you give to parents regarding surgery for their child with charge?
Probably one other issue I would say for a new parent is that often individuals with charge syndrome go through multiple surgical procedures. If they can get those coordinated under one anesthesia, that's going to be very beneficial for their child, both for anesthesia events, post-operative events, things like apneas, arrhythmias, aspiration pneumonias. Those are prevalent under anesthesia. So if you can gather procedures together, you are saving a number of anesthesias. If you need to do a CT scan, MRI scan, if you need to do any of those things, try and do them together, maybe with the smaller things. Heart surgery often has to be done on its own if it's big, but really a lot of other stuff could be done together. And we know that the literature does show, and it's one of the papers I wrote, that there's no harm in doing that, and it actually saves you multiple anesthesias. And I think that's, again, a very good paper to take into your anesthesiologist and say, this is why we want. It's not because we don't want to be coming up to the hospital time and time again. This is actually for our child, and it's going to stop problems, decrease mortality and morbidity, basically. So I think that is important. That's an important parent thing that I would actually talk about very upfront.
What medical interventions might help improve the life of a child with CHARGE?
So what can improve life expectancy for CHARGE? And I would put that into what can improve life for CHARGE. I think really being organized with a checklist of all the medical problems, if we're looking at the medical side of things, looking at your team, your multidisciplinary team has to exist. So that includes, it can include the grandparents, the parents, it can include an extended family that are educated about CHARGE, as well as your individual with CHARGE that can be educated as they get older. All education is good for everybody. And a lovely book in Australia that's about my body and CHARGE syndrome. I love that little book. But so once you've got an educated small community, you've got to educate. So a nurse practitioner that will help you navigate the system. The system out there in the medical world is quite vast. So somebody, now maybe the parent navigates that, they don't have a nurse practitioner, or maybe it's a physiotherapist that does. It could be anybody, or maybe it's me as a general pediatrician helps navigate the other people out there. So you choose your person that's going to help you navigate, and you might need a team of them. I've got me with the nurse practitioner that navigates for our patients, and we have a little CHARGE clinic. Not many places have that, but you need to sort of make your own little clinic group, your own multidisciplinary team, and then you'll have your cardiologist, and you hope that they talk to the general pediatrician, to maybe the neonatologist, nephrologist, the other people that are involved. Certainly your ENT person is a big, good ENT person on side, again, is a good umbrella person. And knowing when you're having anesthesia that you've got ENT on side. What's very good about having an anesthetic would be, I want a couple of procedures done, like a scope, my tubes put in my ears, I'd like my nose dilated for my coanal atresia, my G-tube, Mickey or button changed at the same time. All those can be done. It's not major heart surgery. That probably has to be done on its own. But a few of those little things, so your ENT is there as well, and he's hanging around if he's any good, just in case something happens. So you've got your ENT around, you've got your gastroenterologist around with the looking down. They might be bronching, they might be tube down and have a look at the GI tract, so, and then putting the button in. So you've got your surgeon around. So I tell you what, if something goes wrong, you've got a whole hell of a lot of team around to deal with it. And then post-operatively, you need to have a bed available in ICU, especially in the first 5 years of life. That's always been my feeling, and I've seen disasters happen when that hasn't been available, and the child being discharged home too quickly as well. So watching that, which is a high-risk situation, is important, but also the low-risk situation. So if you move into more older adulthood or young adulthood as well, making sure you've had good puberty hormone replacement, vitamin D, you're protecting the bones. These things are very important to have good healthy bones, healthy life, healthy, just general health. So I think that there's lots that can be done generally to help that little person with CHARGE move through the system effectively. And then the other thing that I think is important is what's happening at school. So is there a good school support, both medically and educationally, and that's helping them psychologically as well? Because that's a challenge. You go to school with CHARGE syndrome, and then all of a sudden you've got the education challenges, but you've also got the fitting in challenges, and that can promote anxiety, depression, negative feelings, and that affects your health as well. So I think, looking at it as a checklist and as a whole, it's good to try and really promote. There's so many bits. It's really like, this is why I love Charge. I mean, so many challenges. To me as a practitioner, you don't know where to start. And that's essentially why we organize something that can help you think, right, the whole person and then the life. And the other thing I tell parents is, you might have a little failure to thrive kiddie early on. Wait till they don't get obesity later on. They need to get exercise like we all do. We need good nutrition. So things like that, they seem basic and they seem sort of normal, but those are important for Charge syndrome as well.
How should the pediatrician approach the child with Charge and the family?
I think it depends at the age that the child is that I've met. So I've just met a Syrian family, and I've just diagnosed their little daughter who's 7 with Charge syndrome clinically. They haven't had the genetic testing done, but they came and she fitted the medical criteria. She had all of the 4 C's, she had a couple of other things, and they felt that she was severely developmentally delayed. She hadn't been to a normal school, she hadn't had proper education, and they didn't think it was worth it. So I think for that family, which I know is very different to how we would look at conditions in our country here in North America, is make sure you're meeting the needs of the child at that very moment. So what she needed was good schooling. She did need to have all the tests. She needed to have a CT scan and an MRI, and we've done that very carefully and haven't rushed into too many things. But actually we decided that schooling and making her feel good about herself. She was quite down and not feeling good. We could see that. She was quite depressed actually, and building her up, and she's actually she feels better. And now I think she and the parents are ready to hit all the other medical stuff of Charge syndrome. So I know she's an outlier, but I think you have to say where the parents are in their journey. So some parents could take the Charge checklist and run with it, whereas others, you'd have to really maybe go through the most acute things that you think that could be dealt with. So somebody as an infant, I would say the GI tract is forgotten.
What medical issues are often forgotten in children with Charge?
Everybody comes in about the heart and the nose and the airway and the things they can see. But what about the things they can't see? So I would say let's not miss the medical things that we can't see. Let's make sure we get the feeding team, the gastroenterologist, because that's going to be one of the things that's going to be with you probably for the rest of your life. So it's funny because everybody sees the big medical stuff, the cardiac surgery looming, the hearing. That's all the stuff you can see, but sometimes it's the other stuff. As a general pediatrician, if I'm seeing a family with Charge syndrome for the first time, I'm often concentrating on the hidden medical problems that don't get addressed by other people. So, for instance, often you've got your cardiologist, you've got your ENT person, you've got your ophthalmologist. They're concentrating on all their little bits, and they're well known with the Charge mnemonic and the 4 C's. But what gets missed is things like the GI tract. So essentially the feeding, swallowing, the what I call Charge reflux and Charge constipation, because they're very different to regular reflux and regular constipation, the Charge gut. And we've been doing a lot of research on, it's actually something that I started in my younger days and I've continued to go with it. It fluctuates, but I've continued to research into the Charge gut. And I think gathering resources on that Charge gut, because not many people know enough about it, is important. They can be found in the literature. I've got them on my website if you want some good overall papers on The charge GI system, I think that is missed and it needs to be addressed. And the number of people I've spoken to at the conference that agree with me and say that there needs to be even more research. But essentially, we've got a much better idea now about the vagus nerve, the microbiome. These are all things that are up and running in the literature now, and just coming into the literature, which you're going to get at conferences more than you're going to get actually that's out there at the moment, because it's cutting edge stuff. But to be knowledgeable about the hidden parts of charge, make sure the kidneys get ultrasounded and checked over. It's all those hidden bits that can, well, why didn't somebody tell me about that question? It says it's there. Again, the checklist is there to sort of go down and say, have those all been addressed medically? And I think that would be certainly where I would start. And I think gathering your team and gathering your information for the family is the best start. Coming to a conference, if they can make it here, is wonderful as well. But not all parents can do that, either mentally or financially. So having the information out there, like the videos and all of this, I think can be very helpful.
What can you tell us about the gut, the microbiome, and the autonomic nervous system in charge?
As far as new research coming through that is not the genetic research, so clinical research that's really cutting edge at the moment is probably the microbiome. And the microbiome is a whole literature in itself. There's lots of information out there regarding the microbiome of people with autism, people with Crohn's disease. There's a lot, IBD. And we are doing research at the moment on the microbiome in charge syndrome. We know it's different. It's different to your regular microbiome in a sibling pair, for instance, one with charge, one without charge. But we also know if the charge gut seems to be working normally, that microbiome seems to be working normally as well. So your microbiome is actually what's happening with the microbes, the bacteria that are there in the gut, which are trillions of them, but they're different groups of them. And we've got one called the Bacteroides, which is the bad the not so good ones, and we don't want an overgrowth of those. And then the other one is the good ones, which is the Firmicutes, and we want lots of those. And we know in charge syndrome they're out of balance. So any way we can think about getting those in balance, so that will probably be the new research coming through, and that could be fecal transplants, implants, it could be various milks that are being made up, or substances like your probiotic, but they're actually the bacteria. But I think also with the microbiome is talking to via the vagus nerve, is speaking to your brain. So you've got a feedback loop that's going on there. And the number of people that I've spoken to about that feedback loop probably not working. So the autonomic nervous system, which gets followed down through the vagus, which is your parasympathetic and sympathetic, they affect really how you're in balance, how you're in control, how you're what's called homeostasis, your heart, your respiratory rate, your gut, how all of that is working. And that's really, again, a feedback loop, like an endocrine feedback loop that's always reading all the time. So it's like your gut talks to you. That gut is actually really talking to you. So those bacteria are sending signals back. We know that the vagus nerve is abnormal, like a facial nerve is abnormal, olfactory nerve. We know the vagus nerve is abnormal. We've got that information from the zebrafish model of charge syndrome. So we can, again, educate our doctors about that. And, when they say, oh, it's just a bit of constipation, I would like you to go away and say, no, I'm afraid this is charge constipation. And this is because they've got abnormal input or output from the vagus nerve. They've got abnormal nerve plexuses that wrap around the gut. It's not reading the gut properly. There is vagal nerve stimulation that's being looked at, and some people have got those. I've seen somebody today with that. So I think that there's a lot of things that are going to be out there pretty soon, actually. It's about like the driverless car. We are going to be seeing great things in the future, which I think the charge family can jump onto, and they will be in the forefront of using.
What are some of the autonomic nervous system issues in adolescents and adults with charge?
I'm very interested in the adult problems, or the older adolescent, young adult problems that happen in charge syndrome. I've always been interested in that, and often those areas fly off in their own direction. So posterior orthostatic tachycardia syndrome, known as POTS, is something that we do see in our regular population. It's interesting because I think it's not really been studied at all in charge, but it's been brought to my attention, as many of these things are, by parents. So looking, especially in the 12 and up, especially when the kids start going through puberty, it's really, again, it's an autonomic nervous system problem probably, and maybe we shouldn't call it POTS, and we should call it an autonomic dysnomia. It's an autonomic nervous system that's not working properly. So again, it's a feedback mechanism, like the vagus nerve, which is not feeding back properly. So it's not regulating your heart, it's not regulating your respiratory system. And we're seeing that in some of the models, the animal models that we've been doing, but certainly there are good checklists out there for POTS, and there's very good, I think there will be good information at looking more at that autonomic nervous system. How we're going to deal with that, again, there are some drug mechanisms, there may be some vagal nerve stimulus devices that could be used. There's thoughts about all of this. There's certainly attachments to the ear that have been discussed. So I think there is much more that we can think about the autonomic nervous system, and that the autonomic nervous system also ties into the gut biofeedback. So really we're talking about quite a delicate system that works in all of us. We don't have to think about it, it's autonomic. In charge syndrome, we see that system not working properly. So, and again, I think it's the kids don't feel pain in the same way as everybody else seems to feel pain, and they're going through life probably in a lot of pain, or in a lot of pain is there to tell you to stop doing something. Don't touch, it's painful. Don't do that. It's upsetting my inside. So if you haven't got a system that's reading that, then it's going to damage you if you don't feel, see, if you don't have a system that's actually protecting you. So I think we're going to see a lot more about the autonomic nervous system, and the sort of subgroup of that is POTS. Knowing whether there's something going on with I think the autonomic nervous system is with us for all our lives. We need it. So it cannot be working as a young person who's not really up and mobile and moving around, is on the floor a lot of the time, may not need to have as much of an autonomic nervous system, as, depending on what's going on with them, and depending on lots of things like infection and things like that. But essentially, things change as a child gets older and grows into adulthood. We know that actually the stuff that hits adolescents, often this huge fatigue that they get, and the sweatiness, and the things that sort of they just don't feel well, and it's very, very, very variable. It's variable, and it's usually soft signs of what's going on. And I think one of the important things is not to rush into a diagnosis. Oh, it must be the autonomic nervous system. It's to do a good head to toe in history, head to toe in examination, and before you know where it is, the balance isn't just the balance organs in charge, it's because they've got wax in both ear canals and it's completely blocked and their balance is off because of that. So it can be something simple, it can be something, a severe infection or a mild infection. So it's important it's very easy to miss things in charge syndrome. You've got the kids that have challenges in communication. You've also got not only some problems with communication, you've got their whole bodies not communicating with them. Their systems aren't doing good readouts. The machine isn't doing a good readout. So then how can you actually then communicate that, wow, it's not right? So I think it's all, and again, I've been so fascinated with charge syndrome because it's a conundrum. You've got to really work the puzzle, you've got to really work the system and be forever thinking outside the box.
Are there any final things you would like to tell us about adolescents and adults with CHARGE syndrome?
In the young adults and the older adolescents, there are a few things that can start to pop up. You feel like you've gone through this whole journey and you've got through the rough times and the school and the career and everything, and all of a sudden medical things. And these can be weird things, so there's something to be aware of. Dumping syndrome is very interesting, much more common in kids that have had Nissen's fundoplications or something that's gone on, they've had surgical procedures with the gut, and that involves a carbohydrate load, like a bagel, going into the gut, and then all of a sudden it seems to be digested too quickly this time, and then the sugars go straight into the jejunum, the upper part of the small bowel, and then insulin gets released, and then the blood sugars go boom down, and with that is called dumping syndrome. It's like the food is dumped in, insulin up, and then your sugars go down and you start to get sweaty and hypoglycemic, and that can be tested for, and it can be prevalent. How prevalent it is, I don't think we know, but it certainly seems to be something where the kids, when they start to eat more, they start to eat faster, they start to eat more carbohydrate, then that seems to be when that hits. So that's to be aware of, and that can just look like fatigue, sweatiness, not really sure what it is. So think about dumping syndrome. Think about POTS, which is posterior orthostatic tachycardia syndrome as well, related to the autonomic nervous system. That can look very similar. So you've got similar things that are going on there. You can have things like gallstones. You can have things that the thyroid then starts to bucket out, which is quite common in the general population, but it can be quite dramatic in charge, and also it can be missed because everything else is going on. So it's really thinking about all those. And then I think for adolescents, the arrhythmias of the heart, they've had their heart all fixed up, they only need to go every 5 years, and all of a sudden they're feeling odd and fainting or having these drop attacks. And so, wow, could it be an arrhythmia? So it's those things that need to be readdressed. I find as a pediatrician, going back over the history, so you had reflux as a baby. But you've been fine for many years. Well, maybe a bit of it's coming back. Wow, you've had migraines in your family, and you may have had them when you were little with abdominal migraines. Wow, what's coming back now is you're getting these odd cyclical vomiting attacks. Could that be more like a cyclical migraine? So it's always good to look back and then look to see where you are now, look from top to toe, and then try and do some educated guessing and read the literature. And I've got a great website which will go up somewhere, but it's www.drkimblake.com, and all my papers are on there. Lovely little one about dumping syndrome and a great one of the zebrafish.
For information and resources about CHARGE syndrome or to make a donation, visit chargesyndrome.org and click the links in the description below.